Hello students, today we will discuss with the topic testing of hypothesis in research or in research methodology. You can say the whole research is based on some assumption, and that assumption without any baseless assumption, you can say, is resulting in baseless research. That is why it is always suggested that the hypothesis of any research should be tested. It is a very important part in research. Now, under this topic, testing of hypothesis, we will discuss that what is hypothesis. Next, we will discuss how it is prepared, how it is prepared, and then we will discuss how it is being tested, how it is being tested. Before that, before discussing these points, we will discuss few basic terms, basic terminologies related to this testing of hypothesis, so that whenever in the next discussions these terms will come, you will understand. First term is population, very important point. What is population? Here population does not mean the census meaning. Here population means the collection of well-defined objects. Clear? Collection of well-defined objects. And the objects may be people, some things, commodities, etc. So the total collection of those objects is known as population. Next, the important point is sample. What is sample? The sample is the particular collection. Sample is the particular collection on which the statistical testing is to be done. Now, the sample is the particular collection on which the statistical testing is to be done. Next point. Test of significance. Very important point. Test of significance. Significance means whatever testing we are doing during our research process, the testing should be between two samples or one sample with referred to standardized norm or standardized value. Clear? So test of significance always will be between two samples or one sample with a fixed norm or value. Next important term is hypothesis. It is one sort of assumption. Hypothesis is an assumption. We are assuming for the testing of significance. So hypothesis is the assumption which will be tested, or which is test significance, which should be testing of its significance. Now, what we will assume in hypothesis, what we will assume, what will be our assumption? We can assume that there is no difference between the observed data and the theoretical data. Our first assumption may be there is no difference. No difference between the observed data and theoretical data. And if this will be the first assumption, then automatically the second assumption will be there is difference between the observed data and theoretical data. Clear? So our assumption will be either there will be no difference between observed data and theoretical data, or there is a difference between the observed data and theoretical data. Now, if there is no difference between observed data and theoretical data, it is called, or it is known as, null hypothesis. It is known as null hypothesis, and which signifies with HO. So if our assumption will be there is no difference between observed data and theoretical data, then it will be null hypothesis, which is sign is given HO. In the contrary, when there is difference between observed data and theoretical data, then it will be known as alternate hypothesis. Then it is known as alternate hypothesis. So, in short, when there is no difference between observed data and theoretical data, that will become null hypothesis, HO. And when there is difference between observed data and theoretical data, then it will become alternate hypothesis, which is written as HA. Now, in research process, when null hypothesis HO is rejected, means it is not been accepted, then automatically alternate hypothesis will be accepted. And in contrary, when the alternate hypothesis is rejected, then null hypothesis is accepted. Now another important point, important term, that is level of significance. The level of significance which decides when null hypothesis rejected and alternate hypothesis accepted, or vice versa. It means with the level of significance we can reject, or we may reject, null hypothesis and accept alternate hypothesis, or we may reject alternate hypothesis and accept null hypothesis. Now in the level of significance there is two slots, that is 5% level of significance or 1% level of significance. What is this? Whenever the case will be given or the question will be given, in the question or in the case it will be mentioned that you have to find the level of significance by considering 5% level of significance or by considering 1% level of significance. This will be given in the question. Now, when the value, the statistical value, when the value is less than the level of significance, when the value is less than level of significance, then null hypothesis accepted, and when the level of significance is more than the level, either 5% or 1% given, then alternate hypothesis is accepted. Automatically null hypothesis is rejected. So this point is very much important to remember, that when the value is less than the level of significance, either 5% or 1% as per given in the question, then null hypothesis accepted, alternate hypothesis rejected. And in the contrary, when the value is more than the level of significance, either 5% or 1% as per given in the question, then null hypothesis rejected and alternate hypothesis accepted. Now this situation, this thing, I will explain you with an example. Now the example is, one medicine company one medicine company is launching one new drug in the market. Already that drug's former version is available in the market. Now they have updated that formula and they are launching newly in the market. Now before launching it, they have to test the significance, how far the new drug is affecting the people, the patients. Now in this case, we can assume that in the former drug and the new version drug, there is no difference in its result. Or we can assume that in the former drug and the new version drug, there is difference in their result. So these two statements we can assume as null hypothesis and alternate hypothesis. Which will be null hypothesis? If we will assume there is no difference between the old version drug and new version drug's result, then this assumption will be null hypothesis. And the alternate hypothesis will be the old version drug and new version drug, there is a difference between its result. It will be alternate hypothesis. Now students, this level of significance we can test. The methods of testing the level of significance are as follows. Number 1, chi-square test. Chi-square test. It is given in the sign as chi-square test. Next, number 2, second point, T student test. T student test, or in short we can say T test. First type is chi-square test, second is T test, and third it is Fisher's Z test. Fisher's Z test. So in short, the level of significance is testing through these 3 methods in generally. Number 1 is chi-square test, number 2 T test, and number 3 Z test. In the next session, we will discuss separately about the chi-square test, about the T test, and about the Z test. Thank you very much.